Welcome to Philly Live. I'm Sheila Watko. Today we're talking about an important topic, especially for young adults and parents of kids and teenagers, sports injuries. I'd like to welcome our guest, Dr. Naomi Brown, a Pediatric Sports Medicine Specialist at Children's Hospital of Philadelphia. Dr. Brown, first of all, thank you so much for joining us today.
Thank you for having me.
A very important topic we're going to get into. You focus on sports injury prevention, overuse injuries, and pain management. What is the biggest misconception some parents have about sports injuries in teens and young adults?
I think the biggest misconception is that people think that kids are just little adults and they can be treated as such. And sometimes it's really difficult to navigate kids' injuries because of the complexities of their growing bodies, of the effect that the injury has on their psychological aspect in terms of how does it take them out of sport and away from their friends.
Now, how and when do teenagers' bones actually finish growing, and why does that matter when they get a sports injury?
So it really depends on the person and their development. So in general, most women are done growth about 2 years out from their first menstrual cycle, so typically maybe 14, 15 years of age. Boys are a little bit later, typically 17 to 20. And so if you have an injury to the growth plate or to the body during a growth cycle, it can really affect their recovery and how they're treated.
Can you tell me a little bit more about what a growth plate is?
So the growth plate is an area at the long bones or also at where the muscles are attaching, the tendons are attaching, that are active areas where there's cell turnover, where the cells are basically saying this is where the bone needs to grow. And so you see them at the ends of the long bone. So typically when you think about a growth plate injury, we worry about at the end of the femur or the tibia, at the ankle, but you have growth plates in your fingers and your toes, you have growth plates in every part of your body.
Why is it so important for a teen with a sports injury to be seen by a pediatric sports medicine physician rather than a general adult orthopedic?
So one of the biggest things for me, at least, is our training, right? So we are all trained in both adult and pediatric sports medicine. And so if I have someone who's coming into the office who has this kind of weird injury, maybe it seems like something that could be kind of bread and butter to the adult world, it's actually maybe a little different because their bodies are more likely to get an infection, or there's something rheumatologic going, or there's something big picture. Unfortunately, sometimes serious, like I've unfortunately diagnosed cancer before. And so if we're not in tune to those nuances in the pediatric world, then we might miss something. Eventually it might get diagnosed, but it might get diagnosed much faster if we're seeing a pediatric sports medicine specialist first.
Okay. And Dr. Brown, what should those families with older teens or young adults, say ages 16 to 24, whose bones may still be growing, what should they know about choosing a pediatric hospital like CHOP for sports injury care?
So for me, CHOP has every part of the treatment process, right? It's, you have an athlete that's coming in, or even someone who's not an athlete just had an unfortunate injury, and they are getting the diagnosis, they're getting the imaging quickly done by pediatric institution where we have, child life specialists that can help if there's anxiety about an MRI, to our pediatric surgeons, and if you do need surgery, then we have pediatric anesthesia that can help with that, where again your body is different in terms of the physiology during surgery. And then our physical therapists as well. We have dedicated sports physical therapists to pediatrics, special training, where when you're in the physical therapy office, you're with teenagers, you're more engaged with it. We can make sure that we are getting their best care from start to finish.
Can you give me an example of a type of injury or situation where that pediatric expertise makes a real difference in how a teen heals and returns to their sport?
So I think one of the best examples I can use is an ACL injury. With the recovery, there's such an important piece to the nutrition and psychological aspect, and that's part of our Stronger Than Ever program. But when you're in surgery, the surgeons have pioneered some pediatric ACL reconstructive techniques. They are experts, world-renowned experts in ACL reconstruction. And so you're not just getting the surgery, you're getting care of the entire patient. When surgery happens, you're with pediatric anesthesiologists because, like I mentioned before, you're not a little kid, you're not a little adult, you are a pediatric patient, and you need to make sure that you're having the right anesthesia as well.
Sounds like a wonderful program and options that you have for these kids and for the families having to deal with it and the parents having to figure it all out. For more information, visit the sports medicine page at www.chop.edu. Thank you so much for all of this very important and, quite frankly, quite educational and interesting information, Dr. Naomi Brown. Thank you so much for being here, and thank all of you for watching Philly Live today. Have a great day.